because we use a couple of terms like progression-free survival, and you talk about complete response. Other people may see the overall survival and disease-free survival. Can you maybe just explain it to us what
Sure.
those terminology means? Yeah.
So, progression-free survival is the time from starting treatment until the tumor has progressed or gotten worse using our standard radiographic criteria called RECIST. Overall survival, of course, is time from treatment until death or until last follow-up. And of course, complete response used to be the tumor's all gone. We can't find it anywhere, either by physical exam or radiographically. And that still is a definition. But with the immunotherapies, we've come to understand that we've got to broaden that a little bit because we're missing a lot of complete responders. There are patients who radiographically still have some evidence of tumor that we can see, but if we biopsy it, there's no viable tumor. So we now call those patients pathological complete responses.
Just
And
a new term.
yeah, that's a new term. And we also have another term where same thing, where the tumors have shrunk, but they're still detectable, say, by CAT scan. But by PET scan, they have no FDG uptake. So those are called metabolic complete responses. And we have more and more data now showing that those are durable responses. Those are real. So in immunotherapy patients, that's what we're going for. We're going for some kind of complete response, either metabolic. I have several patients now, years off treatment, who still radiographically have tumors in their lung, but they haven't changed in size, and they're metabolically cold by PET scan. And sometimes we biopsy them also, and they're non-viable. They're just sitting there. So those patients do quite well.
Well, when you say they're sitting there, are those melanoma cells, or they just like residual debris of the?
Yeah, if you biopsy them, you usually find that they're necrotic, dead melanoma cells, or you find that they're it's an inflammatory mass, and there aren't actually any cells, any melanoma cells, and you'll see melanophages or macrophages that have eaten the dead melanoma cells.
And you're following those patients just by imaging. You just want to make sure there's no increasing in size,
Right.
And then you combine it with a PET scan to make sure this is cold and not hot, basically.
Yeah. So one of the really fun but new problems we have sometimes is knowing when to stop treatment.
Yeah.
Right. So you have a patient who's on immunotherapy, who's had a dramatic response radiographically. It feels fine, but on CT scan, you can still see some small tumors. And they haven't, let's say they may not have changed for 6 months or maybe more. And at what point do you say, okay, we're going to stop? So in those situations is when we'll try to biopsy something, or we'll get a PET scan.
So it's yeah, you don't have a clear grasp of what's going on.
It's also in the
I guess
old.
that's where your experience, that's all the medicine come in, right? You don't have enough data, but you have your kind of a gestalt, clinical gestalt, to sort of see and how the patient in front of you is reacting, basically.
Yeah. So, and sometimes patients are a little hesitant to stop treatment, understandably, but then you have this kind of funny discussion with them. Funny being odd, not hilarious, but just saying, well, we're gonna. You weren't planning on being on this drug for the rest of your life, right? Right. So that means we're going to stop it at some point, right? Right. So when do you want to stop? I mean, if you've had a patient whose tumors have dramatically shrunk and haven't changed, say, in 6 months, and are metabolically cold, you can say to the patient, listen, there's nothing more is going to happen down the road. We're not going to come to another point where we'll say, oh, now's the time to stop, right? So it's kind of arbitrary. Also, given the fact that these immunotherapies, the drugs themselves, hang around for quite a number of months, and we think that the immune mechanisms are continually ongoing, I feel comfortable at some point just stopping.
No, those are really, really interesting.